everybody, my name is John Blanchard and I'm a family physician here in Michigan. If you see my videos in the last few days, I'm talking to you from the COVID camper. I'm living in this camper while this viral pandemic's going on, so I don't bring the virus home to my family. And I'm trying to get good information out there about this virus and what's going on. If you've seen the videos before, I cover questions about COVID that I'm getting during the day from patients. I'm also talking about one thing I'm grateful for, one positive thing that I hope comes out of this viral pandemic, and then finally talking about how SALTA direct primary care works for me and why I like being a direct primary care doctor. For those of you who don't know, direct primary care is a different type of model of primary care where people pay a monthly membership fee or companies hire us to take care of their employees, and for that, that we're able to provide more time and attention and access for our patients. I'm getting a lot of questions about how to talk to children during this time about this virus. And when I say children, I'm talking about anyone under the age of 18. For a lot of us adults, this is a fearful time. And tomorrow I'm going to talk about how, as an adult, we can deal with the fear and the anxiety about this virus. But I think it's even more difficult for children under the age of 18. This is a very disorienting experience for them. Their whole world has been changed. And I'm getting a lot of questions about how we should talk to our children at various ages about this virus and help them to cope with it. If you have questions for me that you want me to answer on these videos, just go to facebook.com/Salta of Troy or facebook.com/Salta of Clarkston, and you can post your questions there and I'll try to answer them on this. So how do we talk to children about what's going on with this? And we have plenty of fear going on right now with this virus. In the news, we're talking about it all the time. The children are now sequestered in the house with their parents, and there's a lot of fear. And what I'm trying to get across in this video is that there's two emotions that I think drive most human behavior, and this I think has been true throughout all of human history. There's lots of different emotions out there, but the two that drive, I think, most human behavior is love and fear. And we have a lot of fear going on right now, and so when I talk about how to talk with your children about this, I thought about how I can make it simple. So the way to make it simple is, as parents, loving our children comes easy to us, right? So think about how to help them cope with this from the perspective of that love, okay? Because love is the antidote for fear. And our children, they're going to have a lot of fear about this right now. And again, it could be all ages. So when you think about how to help them cope with that, think in terms of how you can express love to them as an antidote to that fear and make it age appropriate. So if they have questions, let them ask their questions, and it's about reassurance, right? So reassurance is a form of love for your children, and reassuring them at their different ages that everything's going to be okay, and that let them ask their questions and give them age-appropriate responses. Think about in terms of, again, expressing love. So there's different ways that we can express love. Allowing them to ask their questions, answering them in an honest way. Children need information. Again, make it age appropriate. Answer it in an honest way, in a caring and a loving way. But also, we express love by spending time with our children. So spending time with them, quality time with them, this is a great time to do that. Playing games, participating with them in their homework, those types of things is a great way of helping to alleviate the fear. Communicating with them, love is expressed through communication, so answering their questions in an honest way and in a reassuring way, I think, is a very important way for you to help them deal with the fear. Another way is empowering them to care for other members of the family. So this is a great time to get your kids involved in sitting down and saying, these are all the things that need to be done around the house, and empowering them in, again, an age-appropriate way to participate in caring for each other. That's an expression of love as well, and encouraging that and fostering that. Another thing is they're away from their friends, so encourage them to use social media, FaceTiming or video chat, to connect with their friends. Again, that's sharing of love between friends. There's lots of different ways that we express in love for each other, and between friends it's a way of connecting on the phone, video, that kind of thing. Those are all, I think, really good ways to help them deal with the fear that they're dealing with. Words of affirmation, being positive, having positive perspectives, helping them to think in a positive way. Physical touch is another expression of the way that we express love, so lots of hugs, sitting together on the couch. Again, close proximity is a great way to express that love and allay the fears that people have. So those are some of the things that I think are important during this time with your children. Again, that love is what's going to conquer the fear for them that they're feeling about what's going on right now. So a few things that I'm grateful for, talking about love. My neighbor brought over zucchini bread for me, and she brought over cookies for me, my favorite chocolate chip cookies. And my wife is a fabulous cook, and every night she's making me a healthy plate of food for dinner, and she's bringing that out to me. We're keeping our distance, but she's putting it out on the porch for me, and so I'm really grateful for that. And what I'm really grateful is that I can eat the cookie, and my wife's not here to yell at me. And so I'm really grateful about that. I have a feeling that the COVID camper is not going to be good for Dr. Blanchard's weight problem, but we'll get through that and get back on a healthy schedule soon. One positive thing that I hope comes out of this COVID pandemic, this virus, is that we all learn, again, that fear and love are two extraordinarily powerful things that drive our human behavior, drives the way that we think, drives the way that we communicate, drives the way that we act around each other. But the most important thing is that love is the antidote to fear, and love will always conquer fear. And so we want to always keep that in mind. That's why you'll notice at the end of these videos, I say, love each other. That's for a reason. It's because love is what's going to conquer this fear that we're having and get us through this time together. So the last thing is, what do I like about being a direct primary care doctor? How does Salted Direct Primary Care work for me? It comes down to love. As a primary care physician, this model allows me to give access to my patients. It allows me to have time with my patients, to express love through the care that I give to patients, and for them to express love to me through that relationship, that trusting relationship that they have in this therapeutic relationship between the physician and the patient. The direct primary care model really fosters that and gets the paperwork of insurance companies and billing insurance and all that nonsense out of the way, and it restores the humanity to healthcare. And so that's one of the reasons why I really love being a direct primary care doctor. Again, follow us on Facebook.com/Salted of Clarkston, Facebook.com/Salted of Troy, or if you want to learn more, you can call Kyle at 248-922-3076. He'll be happy to answer all of your questions about our practice. We have 6 locations, and you can learn about direct primary care and see if direct primary care can work for you. Come back here again tomorrow for another post, and stay safe out there and love each other. See you then.